Welcome, everyone. Thank you for joining us today for our Thursday, February 10 meeting of the Emergency Medical Care Advisory Board. I'm happy to have you guys with us today. We're going to take a roll to see who all is here. So, Mr. Ferris, could you do that for us?
Certainly, sir. Chris Miller.
Here.
Leslie Wilmer.
Here.
Dr. Lyon.
Here.
Tyler Weitzel.
Here.
Chief Wells.
Here.
Scott Hurlbert.
Here.
Chairman Naggard is here. John Surface.
Here.
And Orchel Cryer.
I am here.
We do have a quorum, Mr. Chairman. However, I do need to make one clarification before we move forward. I'm very happy that we were able to fill some of the vacancies, and today we have some of the alternates that are present and watching along with everybody else. But for the sake of voting, I would like to clarify that we have a quorum of members and that the voting will be amongst the members only. We don't want to have 2 votes per section of MCAB. Is that correct, GK?
That's correct, Mr. Ferris.
Thank you. That concludes my statement, Mr.
Very
Chairman.
good. Thank you. Thank you, Mr. Ferris. So let's go ahead and formally welcome from Kern County Fire Department. I think this is your first meeting with, isn't it, Deputy Chief Zachary Wells?
Yes, sir. Thank you, Mr. Chairman. I'm happy to be here and serve at the pleasure of the board.
Thank you. It's a tradition that we have for your first meeting, we have you sing something. So if you got a song, you could.
Yeah, I promise you that might take down the internet. So okay. If we could avoid it this time, I would appreciate it.
Okay, we'll let that pass today. No problem. And from the City Manager and Mayor's Association, we have Wasco City Manager Scott Hurlbert. Are you here, Scott?
Yes, I am. Glad to be back. I've been away for a couple of years, but glad to be back. And we have Ann Ambrose, who is the acting city manager in Cal City, as my alternate, and I noticed she is online today.
Very good. Okay, thank you. And from the hospital administrators group, we have from Kern Medical, Tyler Weitzel.
Weitzel.
Sorry, Mr. Weitzel.
Yeah, no worries. Happy to be here. Serve with all of you.
Well, nice to have you guys with us. Okay, let's go. We're going to forego the flag salute since we're meeting remotely. We have already done our roll call. GK, I believe you have a resolution that we need to consider. Is this the thing that has to do with us meeting remotely?
Yes, it is, Mr. Chairman, and we have to renew it every 30 days. So I need to put it in the record, take a quick vote, and then we're ready to go.
Okay, would you, especially for the new folks, would you tell us the gist of what this resolution is?
Yes, the gist is that this resolution allows us to meet remotely as a part of the health emergency declared by the governor. The Brown Act requires us to have public meetings in public places. However, because of the COVID pandemic, there have been certain amendments made to the government code that allow, under specific circumstances, meetings such as this to be conducted remotely. And it will explain itself in the resolution, which I'm going to read in full, but I'll read it quickly. I do believe it's a part of your agenda package as well. Resolution of the Emergency Medical Care Advisory Board, MCAB, authorizing remote teleconference meetings for the period February 10, 2022 through March 9, 2022, pursuant to the Ralph M. Brown Act. Whereas all meetings of MCAB are open in public as required by the Ralph M. Brown Act, California Government Code 54950, 54963, so that any member of the public may attend, participate, and view the legislative body conducting their business. And whereas the Brown Act Government Code makes provisions for remote teleconferencing participation in meetings by members of a legislative body without compliance with the requirements of the Government Code, subject to the existence of certain conditions and requirements. And whereas a required condition of the Government Code is that a state of emergency is declared by the governor pursuant to California Government Code Section 8625, proclaiming the existence, conditions of disaster, or of extreme peril to the safety of persons and property within the state caused by conditions as described in Government Code Section 8558B. And whereas a further required condition of Government Code Section 54953 is that the state or local officials have imposed or recommended measures to promote social distancing, or the legislative body holds a meeting to determine or is determined by a majority vote that meeting in person would present imminent risk to the health and safety of attendees. And whereas on March 4th, 2020, Governor Newsom issued a proclamation of a state of emergency, declaring a state of emergency exists in California due to the threat of the COVID-19 pursuant to the California Emergency Services Act. Whereas on June 11, 2021, Governor Newsom issued Executive Order N-07-21, which formally rescinded the stay-at-home order, as well as the framework for a gradual risk-based reopening of the economy, issued on May 4, 2020, but did not rescind the proclaimed state of emergency. And whereas on June 11, 2021, Governor Newsom also issued Executive Order N-08-21, which set expiration dates for certain paragraphs of the state of emergency proclamation dated March 4, 2020, and other executive orders, but did not rescind the proclamation of the state of emergency. Whereas, of the date of this resolution, neither the governor nor the state legislature have exercised their respective powers pursuant to the government code to lift the state of emergency, either by proclamation or by concurrent resolution of the state legislature. And whereas the California Department of Industrial Relations, has issued regulations related to COVID-19 prevention for employees and places of employment, Title 8 of the California Code of Regulations, Section 32055D, specifically recommends physical social distancing as one of the measures of decrease for the spread of COVID-19, based on the fact that particles containing the virus can travel more than 6 feet, especially indoors. And whereas MCAB finds that state or local officials have imposed or recommended measures to promote social distancing based on the California Department of Industrial Relations issuance of regulations related to COVID-19 prevention through Title 8 of the California Code of Regulations. And whereas a consequence of the MCAB hereby finds that it shall conduct its meeting by teleconferencing without compliance with Government Code Section 54953B3 pursuant to that section, and that MCAB shall comply with the requirements to provide the public with access to meetings as prescribed by Government Code Section 54953E2. Now therefore be it resolved, found and ordered by the MCAB, State of California, in session assembled on February 10, 2022, it does hereby resolve as follows. 1. All of the above recitals are true and correct and are incorporated into this resolution by this reference. Section 2, state or local officials have imposed or recommended measures to promote social distancing. The MCAB hereby proclaims that state officials have imposed or recommended measures to promote social, physical distancing based on the California Department of Industrial Relations issuance of regulations related to COVID-19 prevention. Section 3, remote teleconferencing meetings. The MCAB is hereby authorized and directed to take all actions necessary to carry out the intent and purpose of this resolution, including conducting open and public meetings in accordance with California Government Code Section 54953E and other applicable provisions of the Brown Act. Section 4, effective date. The resolution shall take effect immediately upon its adoption and shall be effective until the earlier of March 9th, 2022, or such time as the MCAB adopts a subsequent resolution in accordance with the Government Code 54953E3 to extend the time during which it may continue to teleconference without compliance with the applicable section of the Government Code. Thank you for your indulgence, Mr. Chairman, and the rest of the members. This is just an important item of record to make sure that this meeting is in compliance with the Brown Act and the exceptions created by the pandemic, so that we can proceed with confidence. This is a vote where I need to record the number of yeses and nos, Mr. Chairman. I think you can do it by voice vote as long as Mr. Ferris can give me the relevant yeas or nays based upon his inventory or his index of membership.
Okay, would you prefer us to do a roll call vote on every vote today, GK, or can we just see if anybody abstains or reneges?
I think we're good with without a roll call vote, except if there are financial matters to be considered, Mr. Chairman. I think on motions to receive and file and other items, I think we can go with a voice vote.
Okay, very good. Mr. Ferris, are there any members of the public joining us? Anybody on the call that we don't know who they are, so we can make sure we get comments from them?
Not that I can see, Mr. Chairman.
Okay, well, just out of abundance of caution, do any members of the public have a comment regarding this resolution that we need to adopt? I don't hear anyone. So, and since we have some new members, we'll just clarify a couple things. When we make a motion like this remotely, please be sure to identify yourself when you make a motion or a second, and that'll help us keep track of who's who, because not everybody's can be seen on the screen at the same time. So would one of the members be willing to make a motion to adopt that resolution?
Lyon, so moved.
Make that motion.
Thank you. Is there a second?
Second.
Second,
Well,
Miller.
Did you get one of those, Jeff?
I got Chris Miller second, and I got Dr. Lyon making the motion.
Okay, very good then. Are there any people who would object to the receiving and filing and adoption of that resolution? Okay, everybody in favor, then please say aye.
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 Okay, I believe that's unanimously supported then. Thank you very much. Next is our.
Thank you, Mr. Chairman. Mr. Ferris, you just need to record that number.
Thank you, GK. Next is our consent agenda. Consent items are considered routine by their nature and generally don't warrant separate discussion. They're identified on our agenda with a CA next to each item. And on today's agenda, those would be item number 6, which is the approval of minutes. And then also item number 12, all the items A through F are on consent. Do any members of the board wish to pull an item from consent for separate consideration? Not hearing any. Are there any members of the public that would like to make a comment about any items that we're going to go ahead and vote on as part of consent? Okay, then would a member of the MCAB board then please make a motion to adopt our consent agenda?
Moved by Hurlbert.
Thank you, Scott. Is there a second?
Second, Chief Wells.
Very good. All in favor, please say aye.
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 Anybody oppose that? Very good. Thank you very much. So our consent agenda has been adopted. Item 6 was on consent, so we've already dealt with that. Next is item 7, subcommittee reports, an APOT task force comment by Mr. Ferris. Mr. Ferris, and why don't you tell everybody what APOT means?
Certainly. Ambulance patient offload times has been an issue for us for some time now. And prior to COVID, we had a task force that was put together. We were meeting on a regular basis, and we were dealing with and creating systems within hospitals and out of hospitals to try and help shorten those ambulance patient offload times. Now, of course, with COVID, that got crazy, literally. And one of the things I'm going to talk about later in my program manager report is the strike teams that we brought in to help deal with that. It had been on the agenda to discuss, and I and get your viewpoint, Mr. Chairman, and the board's viewpoint on, do we think now's the right time to
The phone broke up. Are you asking, Mr. Ferris, if now is an appropriate time for us to reinstate the task force, APOT task force, to start meeting periodically again? Okay, let's make sure who can hear who here. Can everybody hear me?
Yes, sir.
Yes.
Yes.
Am I the only one that
Lost
can't hear
Jeff.
Jeff?
No, I'm sorry. We've been, can you hear me now?
Yes, sir, we can hear you now.
I'm sorry. We've been having issues with our internet at the county level for a few days now. So I apologize for that interruption. So basically, the gist of this discussion is, do we think now's the right time to reinstate the task force, the APOT task force meetings?
Let's start with Mr. Surface. Mr. Surface, do you have any comment about that?
100% agree that it's time to go back to the meetings.
Yeah, good. I concur. There's so many things going on. Be good just to have eyes on and a discussion about things as they come up. So does anybody else have a concern about delaying, or is everybody okay with going forward? Sounds like we're okay with going forward.
Can I just ask who is the task force comprised of?
Okay, Mr. Ferris?
It's comprised of members from all the hospitals, from Kern Medical, Mr. Weitzel, the ex-CEO was a member from Kern Medical, but since he's left, we will have to get a new member from Kern Medical. It's comprised of members from all the hospitals and the emergency room departments. And prior to COVID,
Did
Jeff, you
everybody
need
else
to
lose
you need to repeat everything after prior to COVID.
So comprised of all the emergency department representatives, hospital administrative representatives, the first responder agencies, fire, as well as transport agencies. And the goal was to try to look at all avenues to improve ambulance patient offload and get our transport crews back out in the field.
And how frequently were they meeting?
I believe it was quarterly.
Okay.
Yes, it was quarterly.
Okay, then
Okay,
are there
so
any
we
members
will
of-
move forward then with that. I'm sorry, Scott Hurlbert has a question. He has a hand raised.
Hi, Scott.
Yeah,
Yes,
so-
sir.
So are any of the MCAB board present today? Are they involved in these meetings as well? The entire board?
No, the board was not involved in the meetings. It was led by myself. Dr. Lyon was on the board, and then the members from the different hospitals.
Okay, great. Just wanted to make sure I didn't need to show up.
Jeff, doesn't it also include somebody from the ambulance providers?
Yes, I believe it did. I would have to go back and look. It's been so long since I've dealt with that, but primarily it was the hospitals. But yes, we had a representative from the ambulance on there too.
Okay, very good. Okay, any members of the public have a comment about this matter? Sounds like the concurrence of the group is then to proceed with resuming the meeting of those, reinstating those meetings. So is there a motion for us to reinstate the quarterly meetings of the APOT task force?
This is Leslie, I'll motion.
Thank you. Is there a second?
Lyon, second.
Thank you. All in favor, please say aye.
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 Yes.
Did I cut someone off from asking a question? Okay, it doesn't look like it. Okay, were there any that are opposed to reinstating those meetings? Okay, very good. We have unanimous consent to direct staff to reinstate those meetings. Thank you, Mr. Ferris. Just making sure that we follow protocol. Are there any members of the public under item 8 which would like to make a comment to the board today about any matter that is not otherwise on our agenda? Okay, hearing none, we'll go on to the next item, which is item number 9, public request. We have no request from the public to speak or make any reports to us. Now we'll go on to the manager's report, item number 10. Mr. Ferris?
Thank you, Mr. Chairman. I'm going to try and get through this, and hopefully you can hear me the whole way through. I've been getting occasional warning flags, so if that happens, I guess I'll stop talking until they go away. But thank you very much, and I want to welcome all the new members of MCAB here today. I appreciate all of your participation in this very important committee, and it's the work that it does. As you can imagine, Kern County Public Health EMS has been extremely busy since we last met. The COVID-19 pandemic has significantly impacted the pre-hospital and hospital emergency medical systems in Kern County. And it's a problem that's not just unique to us, but rather it has been noted nationwide. Specifically, we have seen unprecedented 911 call volumes, longer ambulance patient offload times at local hospitals, staffing shortages due to burnout, COVID isolation and quarantine, and ambulance decontamination processes that remove ambulances from the system that have transported patients who are suspected or known positive for COVID-19. As we embarked on the pandemic, we had no way of knowing the duration or the impact it would have on the emergency medical services system. On August 27th, 2021, we implemented an emergency medical services system surge plan to ensure resources remained available for those who truly needed them. This plan limited responses to low acuity 911 calls, or we would call those surged calls, introduced assess and refer to Kern, emphasized our straight to triage and patient handoff policies, as well as brought about a contract with Pro Safety, a non-transport standby company, to first respond to as many of those surge calls as possible. In response to increasing ambulance response issues in the system, in December, through the Medical Health Operational Area Coordinator, or MOOC system, the department requested ambulance strike team assistance throughout the region and the state. We were lucky and we were able to secure 2 ambulance strike teams totaling 11 ambulances from multiple counties within the state. These ambulances responded within a matter of hours and assisted by providing much needed ambulance resources to our system. We saw an immediate improvement in our ambulance response compliance as a direct result of these teams. As resources within the region and the state became unavailable due to the Omicron surge, we were able to acquire an additional 5 ambulance strike team from Best Practices Medicine, which is based in Montana, as well as 10 additional paramedics that have been partnered with existing Hall ambulance service staff to increase the number of available advanced life support ambulances in our system. Due to the high call volume of patients being seen in the emergency departments and the high volume of ambulance traffic going to local hospitals, our ambulance patient offload times, or APOT times, at hospitals became a significant hindrance for getting our ambulances back into the field to respond to calls. We were able to locate and secure staffing assistance for 3 of our largest hospitals called APOT offload strike teams. Each team consists of 6 paramedics and 6 nurses with the sole purpose of accepting patients from ambulances and providing care to them until the emergency room staff have the availability of beds to admit the patient. These teams provide a continuity of care to the patients, but also allow our first responders to immediately depart the hospital and respond to the next 911 call. I want to point out that Kern County is the only county in the state to secure these state-sponsored resources. Since the implementation of these APOT strike teams, we have seen a significant improvement in our ambulance offload times. One of the effects of COVID-19 is the need for interfacility transfers. In an effort to open beds, hospitals must transfer eligible patients to other facilities. The increased need for interfacility transfers has added to the massive increase in call volume in Kern County. Hall Ambulance Service entered into a subcontract with American Ambulance of Visalia to assist with interfacility transfers. Beginning January 10th, American ambulances have been operating in Kern in order to handle the unprecedented interfacility transfer volume. This has helped to free up local ambulances to respond to emergency calls. In order to assure that we have enough hospital beds locally, department staff have been continually active in the acquisition of expansion beds and staff for our local facilities. At this time, Kern County is second only to Sacramento County in the number of state-funded expansion teams in operation. Currently, we have ICU and med-surg expansion beds and state-sponsored staff at Adventist Health Bakersfield, Adventist Health Delano, Kern Medical, and Good Sam hospitals, adding a total of 39 ICU beds and 33 med-surg beds. We have assisted in the acquisition of 21 healthcare staff for Mercy, Mercy Southwest, and Bakersfield Heart Hospitals to assist with patient volumes during this 4th surge, and are actively working right now on bed expansion for Rehab Center of Bakersfield to accommodate skilled nursing patients being discharged from local hospitals. Knowing now that the pandemic is not a short-term problem and will likely be around for the foreseeable future, we have also been working towards long-term solutions to the emergency medical services system. On January 25th, the Kern County Board of Supervisors approved a contract for the implementation of the Tele911 System. Tele911 is an internet-based company that essentially adds the ability for a 911 caller to be seen by a physician via a telehealth visit to determine the appropriate path for care. On low acuity scenes, this telehealth visit could result in treatment on scene and prevent an unnecessary transport to our already impacted hospitals. Kern County Public Health, in collaboration with all Kern County ambulance companies, hospitals, and fire agencies, has entered into a campaign to educate the public on the proper use of the 911 system. This campaign was launched in January through a joint community statement from the stakeholders and the release of an infographic that details what level of healthcare service to seek based on your injury or your illness. A public service announcement has been created and will show on television and in movie theaters beginning next week. We are also in the process of mass mailing the infographic to every resident in Kern County, as well as turning the infographic into refrigerator magnets that can be distributed by ambulance providers during calls that may not warrant an ambulance response, and by hospitals during visits that may not warrant a hospital visit. It is our hope that this campaign will help to decrease the 911 call volume and hospital overcrowding. Amid all of the COVID-19 work, the department has also been able to continue its expansion efforts by hiring 2 new EMS coordinators. Mitchell Finley and William Barrett both have extensive experience in the EMS field and have been added to the EMS Emergency Preparedness Division. Mitchell has taken over the 2nd RDMHS position, while Bill has stepped into the grant planning, where he has extensive experience. We have added 1 additional EMS coordinator position, which we are currently attempting to fill. Unfortunately, we had to say goodbye to Annabelle Beltran. However, we've been able to find her replacement, who should be starting in the next few weeks. We've been working with our providers to complete the certification and recertification and accreditation processes for our local EMTs and paramedics as rapidly as possible in order to keep as many staff available for duty as possible. Since we last met, we have processed 230 certifications, recertifications, and local accreditations. Most recently, department staff have been working with local and state CDPH offices, as well as the Kern County Ombudsman, to facilitate the closure of one of our skilled nursing. We've been meeting regularly, and in some cases daily, to assure that these patients are properly assessed and transferred to appropriate facility.
Mr. Ferris, can you hear me?
Okay, I should be back now. Can you hear me again?
Yes, well, back up about a minute there and start over.
Okay. Mr. Chairman, during the last meeting, you asked me what my confidence level was for Kern County making it through this last surge. The reason I was able to respond with such confidence was directly related to several factors. The leadership provided by Bryn Kerrigan, the dedication to the community by the Public Health Department Operations Center staff, and last but not least, my EMS team, who simply do not take no for an answer. It is because of the actions of these staff members that Kern County has been able to accomplish things that no other county in the state has. I cannot say enough about public health staff and their commitment to the people of Kern County. This completes my report, and I'm available to answer any questions.
Thank you, Mr. Ferris. I concur that you guys have done an extraordinary job. And for my colleagues on the board here, it's easy to take this as kind of a perfunctory, boilerplate thing we all just roll in and out of. But our willingness to agree to and pursue resources that others haven't used have saved lives in our community, as evidenced by the reference that Jeff made there to how many ICU beds were preserved, and that's the fundamental part of saving people's lives. So I just applaud not only staff and all the support people, but you guys on the board as well. Okay, colleagues, any questions for Mr. Ferris about his management report? Don't see anyone. Are there any members of the public that have a question for Mr. Ferris about this? Very good, then. Is there a motion to receive and file Jeff's report?
Surface motion to receive and file.
Thank you, John. Is there a second?
Miller, second.
Thank you, Mr. Miller. Okay, not hearing any other questions. All in favor, please say. What was that? Okay, all in favor, please say aye.
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 Anybody opposed? Very good. We have manager's report received and filed. It was indicated in our agenda that there were no unfinished business items. Mr. Ferris, have any unfinished items come to your attention since the agendas were distributed?
No, sir.
Okay. There's no action on item number 11 then. Item number 12, we've taken care of already under consent. Item number 13, there are no miscellaneous documents or, for information for us to file. Item number 14 is board member announcements or reports. Would anybody like to make a report? And particularly welcome to our new members to, tell us anything about yourself that you'd like us to know before we, move down the road as colleagues. Don't see anybody jumping up and down. Okay. Well, not having any reports then, we welcome our new members and thank our continuing members for their dedication to our effort here. We have a couple of announcements. Item number 15A, our next meeting is scheduled to be May 12th, 4 p.m. At this point, we're going to meet live and in person. Is that right, Mr. Ferris?
That's the plan, sir.
Yeah, and it looks, boy, the best news I've had this week is that, as I've asked about of the health department and from the California Department of Public Health, there is no predicted fifth surge at this time. So we may be moving in that direction where we can resume some normalcy. And boy, I'm glad for that. I see Mr. Miller shaking his head. We're all glad for that, aren't we? Yeah, yes, sir, we are. Okay, so that's the next scheduled meeting is Thursday, May 12th, 4 p.m. At Kern County Public Health at their building there on Mount Vernon. And the deadline for submitting public requests on that MCAB meeting agenda is Thursday, April 28th, and at 5 p.m. You can submit them if you have an interest to the Kern County EMS program manager. That would be Mr. Ferris. Okay, are there any other matters before us that we need to talk about before we adjourn? Not seeing anyone. Thank you, everyone, for your help with all this. You make this much easier than it would otherwise be. We'll adjourn then without objection, and we'll see you guys on May 12th. So long, everyone.
Thank you.
Thank you.